little bit about personal protective equipment. What is personal protective equipment? It can be very simple, such as a surgical mask, or it can be a little bit more involved, such as a surgical mask, a face shield, or an N95 mask, gown, and gloves. It's very important to note that personal protective equipment doesn't necessarily just protect you, but it protects those around you. And we're going to talk about that in just a second. Next slide, please.
Jess, can you switch
next slide.
Jess, can you switch the slides? Uh-oh, we don't know what happened to Jess. There we go.
Excellent. So we're going to talk about the universal masking recommendations. We're going to talk about proper use and cleaning of masks just in the next slide. And we're also going to talk about proper use of gloves, which is very important, as Jess mentioned. Gloves are not necessarily a catch-all for protecting our hands, and there's a proper way to put them on and particularly take them off. Next slide, please. One of the things that we've found is that masks can be very protective, I'm not sure we've necessarily found it yet, but what we really suspect is that wearing masks can be protective in these congregate settings in preventing transmission. So one of the things that we've recommended and we've instituted in all of our shelters here in Chicago is universal masking, much in the same way as we mask universally in our hospitals. What masks do, particularly surgical masks, is they don't necessarily prevent you from getting an infection from somebody else, but they protect somebody else from getting an infection from you. As Dr. Rothschild mentioned earlier on in the discussion, there is quite an amount of asymptomatic positivity out there, people that are positive for the virus that don't necessarily know they have it, and wearing masks universally protect other people from those that have the virus and don't necessarily know it. Inappropriate use of masks can make you more likely to get infected. That means that if a mask is touched inappropriately, meaning you're touching the front of your mask, you can inadvertently infect yourself. Also, if you're not wearing the mask appropriately, you can increase your risk for infection. It's always important to remember that hand hygiene should be performed before putting on the mask and after touching, adjusting, or removing a mask. So as Dr. Herrick mentioned, wash your hands, wash your hands, wash your hands. There is not a great recommendation for how many hours you can use a mask consecutively. The best recommendation we have, though, is that you should take your mask off and throw it away if it's become soiled, it's damaged, or particularly if it's hard to breathe through. And with regards to cloth masks, which are becoming a lot more popular at facilities, you should be washing them at least once a day. A great rule of thumb is to treat your cloth mask like you would your underwear and take it off and wash it once a day. Next slide, please. How should you put your mask on? As kind of shown in Darcy's wonderful pictures, you want to put it on by using the loops. Again, not touching the front of your mask, but by using the loops, putting the loops around your ears, putting the bottom around your chin, and bending the top to fit your nose. Most of the industrially produced surgical masks have a thin wire that runs across the top of your nose. You can use both fingers as shown in the picture to help tighten that against your nose, and so it's fitting snugly. You can see the picture on the left shows an individual wearing the mask correctly. On the right is a gentleman wearing the mask incorrectly, and you would not believe the number of people that we see actually wearing a mask just like this gentleman on the right. Note that this is not protective to you or to other people, and that's not how we should wear our masks. Next slide, please. In order to take the mask off, grab the mask by the loops in the same way that you put it on or remove it off. You want to avoid touching your face or the front part of the mask with your face. If you're going to reuse it, you can put it in a clean paper bag. And if it's dirty, please throw it away. You want to store your mask face down so that when you pick the mask back up and you put it on, you can grab it by the loops and put it on. Next slide, please. When you are taking off your gloves, and as Dr. Herrick mentioned, gloves are not protective if you're using them incorrectly. You want to make sure that you're staying away from touching clean skin with soiled gloves. So as you can see in the picture, the first thing to do when taking off gloves is you take, let's say, a right gloved hand, and you touch the outside of the other gloved hand, and you take it off, making sure not to touch the skin. You roll that soiled glove in, or the soiled glove into the glove that's on your hand, as shown in number 3. When you're actually taking off that other glove, you want to take your clean hand and go underneath, as shown in picture 5, to take that glove off, and you roll it over the other glove in the hand itself. So again, if you're have a gloved hand, you're taking off the other gloved hand on the outside. But if you have an ungloved hand, you're taking the gloved hand by going underneath the glove and not touching the outside of the soiled glove. I'm sorry if that was unclear, but it's fairly well described in the pictures as shown.